really glad to have a chance to talk to you as you get together to celebrate 10 years of achievements in the School of Public Health Research and look forward to a further 5 years of work. It feels like a really important time to be thinking about the future of public health, not just as we come out of the COVID pandemic. We've, of course, learned a lot of lessons and need to be thinking hard about how we take those forward in our research and in our activism and campaigning in public health. But also, I think it's helped us to focus on what we knew about the pandemics that we were already experiencing before COVID-19. You know, we do have a pandemic of morbidity and mortality related to climate change, and to pollution, air and water pollution, among others. We've got an obesity pandemic as well, and of course a rising pandemic of mental health problems, especially anxiety and depression, which are reaching such critical levels among our young people. So all of those existing and new pandemics are challenges to us as we think about the future of public health, the research that we need to be doing and the actions that we need to be taken. Of course, we've also now got a war in Europe, perhaps unimaginable to many of us a year ago today. And the repercussions of that war for public health are quite hard to see at this time. We don't know how the war is going to unfold, but there will be short-term, medium-term, long-term repercussions of that war, both direct actions in the war, but also, of course, the consequences of what that war means for our society, our communities, our economies at this time. And the cost of living crisis that is facing us now feels really frightening to me. It feels like we're on the brink of seeing a lot of suffering, a lot of devastation, with potential for short-term impacts on health and well-being and long-term impacts as well. We know that the stress of experiencing financial insecurity is as bad as the material suffering that is caused by it. We know that that source of long-term chronic stress is going to be affecting people's health even after we've come out of a cost of living crisis. The stress that is built up during that period will continue to resonate throughout people's lives. Now, we have a levelling up agenda to grapple with. We have a government that talks about being committed to a levelling up agenda. We need to think hard about what that means for us and whether or not we are seeing the actions taken that really truly will result in a reduction in socioeconomic inequalities and a reduction in health inequalities. It's not enough to have an agenda. It's not enough to have the talk. So it's up to us as public health professionals to hold the government to account and make sure that they do take action to level up and create a more equal society with higher levels of well-being for all of us. And I'm concerned at this time that we're hearing language about health disparities instead of inequalities. We're to expect a new white paper on health disparities. And I really want us all to commit to not falling into that error of our American colleagues and not labelling inequalities as disparities. We mustn't do that. We must stick to our language of social justice. We know that differences in health between groups in the population are an injustice. We know they're inequalities. They're not just differences. And we need to make sure that we talk truth to power when we express our belief in those concepts. Levelling up needs to be about addressing poverty. It needs to be about addressing inequality. It needs to be about ensuring good work for people. And we all know what we mean by that and what bad work looks like. But it's also, of course, about democracy. It's about agency. It's about power and voice. It's about what we need to be healthy in a holistic sense. Levelling up needs to be about making sure that everybody in this country can have purpose, and agency, but importantly, be connected to one another. So we need to think about community as we go forward and the social connections with participants in our research, the communities we work in. We need to be committed to connectivity and co-design and co-production in meaningful ways. So as we continue to seek to promote the health of the public and to create a healthy population in a healthy society, in a healthy economy, we do need to make sure we do keep on speaking truth to power and that we hold our values very dear and display them very openly in all the work that we do. So I wish you all the best for the next 5 years and I hope you can really make a difference. Thank you.